It is time now for the North Iowa Addiction Prevention Alliance podcast. And this month, we're going to talk about the new opioid treatment program at Prairie Ridge Integrated Behavioral Health Care Center here in Mason City. As Shea Jorgensen, the medical director at Prairie Ridge, as well as Elaine Jorgensen, who is involved in the treatment program services, are both joining us today. Welcome to both of you.
Hey, thank you for having me.
Absolutely. You bet. Well, Shea, the new center opened in December, and maybe just, give us a little background, a history about, this new center at Prairie Ridge.
Absolutely. So the new program is called our Opioid Treatment Program, and it's a program that treats people with severe opioid use disorders with a medication called methadone. And methadone's a pretty highly regulated medication, so there's a lot of hoops to jump through with the DEA and a lot of regulations around it. And so it took 1.5 to 2 years to be able to get it lifted off the ground, and we were able to open in December and start serving patients. And the reason it's so important to have it here local is because the medication with its regulations require people to pick it up every single day when they first start it, 6 days a week. And so prior to us opening, the nearest clinic was in Waterloo. So we had people from our community having to drive to Waterloo 6 days a week to be able to dose with the medication, which for many people is just not feasible or sustainable. And so they don't even start the medication. So to be able to offer it locally means we have people now in our area that are able to have access to a medicine that previously was pretty difficult to access.
Opioids, that's been something that has obviously come more to the forefront here in the last few years, and the growth of opioid addiction. And maybe just talk a little bit about, how that has become a bigger concern in our community overall.
So across the country, there's been a major concern with opioids. Many people were started on opioids because of pain prescriptions, and it used to be that there was some misinformation out to doctors and some requirements that doctors had to take pain as like the fifth vital sign. So to ask about pain in every appointment and to prescribe opioids for pain. And the old incorrect medical literature used to say that people could not get addicted to opioids. And so people were pretty quick to prescribe them, and people would get large prescriptions for long periods of time. And what that did is leave people addicted to a medication that then, when literature showed what was actually truthful, was that it is very addicting and very difficult to stop. Then people who were using opioids and in withdrawal trying to stop ended up turning to the streets to be able to find it. So sometimes in the form of heroin or illicit substances, now fentanyl. And so we've seen that happen across the country, including here locally. And what we know is rural areas are more affected than urban areas. And so we see that right here in our community. And there's a number of people that end up dying with opioid overdose deaths.
And maybe, talk a little bit about methadone again, and how that has become the medication for treatment, and what, a little bit more background on that.
You bet. So methadone is a medication it's a long acting opioid. And so it's a medication when people have a severe opioid use disorder, it's really needed because people have such significant withdrawal symptoms that the other medication we use called Suboxone is often not sufficient to be able to help with those symptoms. And so methadone is a medication that allows people to switch over to methadone from their opioids that they've been abusing and be on a medication that keeps them feeling stable without feeling like they're in withdrawal or having cravings. And methadone reduces the risk of overdose. It reduces the risk of relapse. And it helps people start to engage in other forms of treatment. Once they no longer have to worry about withdrawal, then they can start to engage in therapy and oftentimes start to work on other facets of their life that they're unable to work with when they're experiencing withdrawal and just trying to get out of this cycle.
And my follow-up question on that was going to be, some people may hear that, what you just said, and may think that the medication is just an addiction for substituting one drug for another, and that's definitely not the case.
Yeah, that's a common misconception. And I would say the major difference with methadone is it's very long acting rather than a lot of other opioids like fentanyl or heroin. They act very quickly. And so there's a fast onset, but then it quickly drops off so the person's having to then go use again. Methadone lasts, the half-life is 72 hours. So it lasts a really long time and keeps people more stable. So when people have been using opioids for a long period of time, when they try to stop, they're experiencing diarrhea, nausea, vomiting. They feel ill sometimes for weeks. And in that illness is when people relapse. So methadone, it is an opioid, but it doesn't lead to the same high. So when people have a tolerance to opioids, when they're using methadone, they're not getting high with the methadone. They're just using it to feel normal and feel okay. If people did abuse methadone, if people were not using an opioid, it could allow somebody to get high if it was abused. But again, it's very long acting. So it's not going to lead to that level of euphoria that a short acting opioid like fentanyl would.
You talk about long lasting. I was going to ask, is there a length of time that typically a treatment lasts?
That's a really good question and hard to answer. It's a medication that can be used for years to decades if needed. Some people do need to have that long-term treatment. For some others that they want to get stable and they want to get off the medicine. And so then we work to slowly taper them off. But it is a medicine that people can stay on for a long period of time if needed. We talk to people about increasing their recovery capital. And by recovery capital, I mean things like, stable housing, having supports, people to turn to, knowing how to cope with things that are stressful, potentially having a job, so things that keep people kind of engaged in their lives and not needing to seek out a substance. And so once people have some of that recovery capital built up, then we can work towards over time slowly reducing the dose to be able to do that without having people have those symptoms of withdrawal start over again.
Elaine, just talk about your being involved in the treatment program services, and maybe just give us an overview of how this has been a big help for you.
Well, I'll just kind of start from the beginning. I I had a number of surgeries that I had to get done. Uh, I had neck surgery. I've had two different hand surgeries. Um, and I just, it's kind of hard to explain, but you get these surgeries and stuff, and the doctors give them to you for pain, and of course my surgeries were kind of spread out in that. So for the probably the first year after the surgeries, I had access from the doctors, to get the painkillers and that, and before you know it, you're hooked on them, and once you get hooked on them, it's in my opinion one of the worst experiences you'll go through. I know in my case it was the withdrawals. Being in the hospital, for a week and a half, and then even going home after that, and it takes a toll on you, and it's hard on you. But I'm just blessed to have Prairie Ridge with their methadone clinic, and I have already made some major leaps and bounds, and you know the negatives to all of it. You can lose so much. You can lose your family, your job, your business, your friends. It's terrible. But I've been in the program now for 3.5 months. Yeah. And it's awesome. I mean, I'm so blessed to have Prairie Ridge, and, I'm blessed by the grace of God, and just very thankful.
And maybe, both of you maybe could talk about as well. Is it just the medication part of it, or is there also counseling and other things that are involved in the program?
Oh yeah, they have counseling, they have therapy, they have other people in the same situation. There's meetings. There's just Prairie Ridge has got so much to offer. You know, whether if you've gotten down so far where you've literally lost everything. They have a lot of resources and a lot of connections to help with you getting back on your toes. I was very fortunate. I just about lost my business and everything, but by the grace of God and Prairie Ridge, it's life is good. And if you do have the opiate addiction, this is a miracle drug for me. I know it don't suit everybody, but it has been awesome for me. And big thank you to Prairie Ridge too. Just super awesome.
Shea, maybe just talk a little bit as we start to wrap things up here. If somebody listening or watching this thinks they have, or obviously realizes that they have this addiction, what are the right steps to take to get the help that like Delane has had?
So I would say just calling out here or just coming out here. We get people in usually within a day or two, sometimes a few days, but try to get people in right away. The first step is just meeting either myself or a psychiatric nurse practitioner we have named Shelby Allen Bennett. One of the two of us would do the evaluation to see if the person is right for the medication of methadone. And if not methadone, there's of course other medications and other options we have. But that's sort of the first step. And then from there, we get people into the program. If they're appropriate for methadone, we get them dosed that very first day. Then, like Delane mentioned, the other pieces of it are getting them involved with therapy services and just seeing kind of on that for that specific individual what's needed. But I would say the first step is just picking up the phone or walking in the door, and we would get people kind of set up from there.
All right. Anything else either of you want to add to our conversation before we let you go?
I just want to thank you for giving us the time and kind of getting it out there, and it's an awesome program. And thank you guys again. And I want to thank Prairie Ridge. And
I would just add that if anybody's interested, it's a option for people with severe opioid use disorder, and so we're happy to help get people kind of on that track. And if there's any people with questions or interest, just picking up the phone and calling would be the best way to get started.
All right. Shea and Delane, we appreciate you taking the time out. Delane, obviously, sharing your story with us. We greatly appreciate that. And we thank you once again for both joining us.
Thank you, sir.
Thank you. Appreciate the time.
Shea Jorgensen, the medical director at Prairie Ridge Integrated Behavioral Health Care Center here in Mason City. Delane Jorgensen, as well, has been our guest today on this edition of the North Iowa Addiction Prevention Alliance podcast.